My name is Cynthia Lewis. I am Nebraska raised. I went to undergraduate at University of Nebraska in Lincoln. I went to medical school at the University of Nebraska Medical Center. My residency in internal medicine and hematology and oncology fellowship were all done at the University of Nebraska Medical Center. After I finished my training, I wanted to go to a smaller community, and we moved out to Kearney, and we've been here for 24 years. After I came to Kearney, I started my own clinic here in Kearney. And as we've grown, our staff has grown as well. And we have a wonderful group of people here that really truly love the patients, and they really love each other. And I do think it shows from the minute you hit the door that it's just a caring environment, and I love coming to work every day to be around my fellow coworkers. When I was in college, there was an oncologist that came to our pre-med club, and I never knew there was a specialty of cancer. And they were talking about the biology and how cancers grow and what chemotherapy does and how we can stop it. And I was very intrigued by that. And as my career grew, I realized that once I got into it, it's the patients that kept me here. When I sit down with a patient for the very first time, I try to get to know who they are and what's important to them and where their loved ones live. I think humor is extremely important, and I think getting to know who they are and making light of certain subjects just to help ease them really allows our relationship to grow and allows the patients to build that trust that is so important when it comes to their cancer care. Because I'm a female, I do seem to see a lot more breast cancer patients, and I have quite a practice with breast cancer, but we do see the gamut of all cancers. There are certain cancers that need more of a higher level care that we refer to the University of Nebraska Medical Center for that, but we try to keep everything local. I've always had a fondness for the University of Nebraska Medical Center because they gave me the opportunity to have a wonderful career. And an opportunity came up that I could partner with them, and I've always wanted to have an expansion of clinical trials here in town, and we have patients that come from 3 hours away to come here, and if we can allow them to have access to university clinical trials and some of the subspecialists that otherwise they'd have to drive 5-7 hours to get to, I thought that it would be a great partnership to better care for our patients and give them opportunities they may not otherwise have.